Hi guys, so I had a question on social media recently about what is the best way to treat sagging skin or jowls. Now this is a really big question because there are loads of treatment options. First of all, we need to think about surgery versus non-surgical options. So really, if you have very significant sagging of the lower face or of the neck, really a surgical facelift remains the gold standard. Most patients who come to see me, however, want to avoid surgery. So what are the non-surgical options that you can consider? We now know that the mechanism of aging really revolves around gradual volume loss within the face. So that's the fat pads that we have within our face, and also actually post-menopause, the bone starts to recede a little bit as well. So in terms of how we should approach jowls, laxity and sagging, really the first thing to consider is optimizing the projection, the support and the overall facial volume. This is something that we tend to do with dermal fillers. Now there are lots of different materials that can be used as fillers. You can have fat transfer. My preference is for hyaluronic acid dermal fillers such as Juvederm and Belotero. The reason I like these HA fillers is because we have HA in our skin anyway. Essentially, it's a naturally occurring substance. I also like the fact that although these are long-lasting materials, they aren't permanent, and that's really important because our face is constantly changing as we age. So anything that's put in permanently just doesn't fit with how the aging process actually works. I also like HA fillers because they're reversible. So in the very rare instance that we have an issue, we can actually remove this filler relatively easily. So in the very rare instance that we have an issue with a filler, then we can actually remove the product if it's required. Once we have optimized the projection and support using a filler, we can then use some other treatment to tighten around what's already there. Now for some patients, they just don't want to have fillers, and that's fine too. I firmly believe that you don't need to have any treatment done at all. It's a question of what you want to do, and some people just don't like the idea of fillers. Treatments that we use to tighten the skin essentially work by heat, and to do this we can use either radiofrequency or we can use microfocused ultrasound. These are different technologies, but essentially they work in the same way. We heat the collagen in your skin up to a certain point, it denatures, it shrinks, we get a contraction, and then we get a healing response. And that healing response is really important because it stimulates collagen, elastin, and other elements of the extracellular matrix, and that can then lift and tighten. So what is the right option for you when it comes to lifting skin laxity and jowls? Well, there is no right answer, and I think the most important thing when you're considering any treatment is to have all of your options, and that's why a consultation is so important. So when you come to see us, we take very detailed photography, we take 3D images as well as complexion analysis, and based on that, we can then come up with a plan that works for you.